Hi, this is Saima, MD, MPH. We're talking about modeling projections and what's next with the COVID-19 crisis. When we speak of modeling projections, it's not a crystal ball scenario. We're trying to predict what will happen given some past occurrences of COVID-19 and what is likely to happen next. Models have kind of taken center stage, and in many key policy decisions surrounding COVID 19, it's largely due to the unprecedented nature of the situation. And the way the disease is spreading, that there's there's a big need to make informed policy decisions now, and how best to manage that path forward. So researchers are using these models to estimate important epidemiological data and the characteristics of this disease, such as incubation period, transmissibility, if they're asymptomatic, how severe it is, distancing, physical distancing, airport screening, travel restrictions, contact tracing, and now we're talking about reopening. So clearly these models can be very important tools for understanding the disease and policy implications. So how do we go about this? So we need to understand the very basic idea of one of these IHME models, which forecasts the number of hospitalizations and deaths in the US and by state, along with the timing of the peak in hospitalizations and deaths through August 2020. Initially, this model had forecast about 80,000 deaths in the US by July. Now, since these results have been updated daily, and as of about mid-April, around April 12th, the same model has revised the trends downwards to say about 61,545 deaths by August 4th. So that's 20,000 less deaths predicted. Now that we're riding the curve a little bit downwards, in some places, excluding, of course, the hotspots, and we're being told that there may be a phased or a gradual reopening in America. How is that going to work out? Reopening a city, a state, or a nation should actually depend on adequate testing. For infections, you do the diagnostic PCR testing, which is it's an RNA test that's run on people who are suspected sick with the virus and who meet a certain criteria. And for if they've recovered or if they have the immunity, there's antibody tests. If you don't do that, it's like shooting in the dark. So to that effect, 2 new serology tests have gained FDA approval. There's also a test at Mount Sinai that looks at recovered and now immune cases for those people who've recovered, and that is an immune globulin G. That again is a serology test, which is a protein that exists in the blood after you've recovered. Again, why is serology so critically important? It answers the question of how many in the population are immune. It fleshes out the denominator for the denominator in the model scenario. It lets us know if we relax the physical distancing restrictions, will this disease come flaring back, or will it be a little bit tampered down? Have we averted the deaths completely, or have we delayed them somewhat? It will answer questions about how long the immunity will last, how hopeful we can be about this vaccine that might come as a result, and all these practical concerns that people have about COVID positive people. How soon or when are they able to re-enter society? When are they able to go back to work? Things of that nature. And also, for those people, the serology tests for those whose nasal swabs might not test positive or not might be giving us a falsely negative PCR test results with the nasal swab. These serology tests are very helpful adjuncts to that process. To that effect, what else can inform our what's next in going on for us? So let's assume that modeling is correct, and we're saying that there is a case for vaccines to be made in the decision for reopening of the states gradually. Let's also assume that the immunity that we develop as a result in our body, whether it be through infection or through herd immunity, which is what you get if a whole community is exposed and other people develop the immune globulins in their body to protect themselves, that is only 2 years at the maximum. The fastest vaccine development process to date that occurred during the Ebola outbreak, it took about 5 years. And since then, we've had bounds and leaps of technology. So we could possibly whittle down that time a bit. Even to say that even if a vaccine is brought out as early as next year, the safety profile of that vaccine will only be a few months worth of data, since the outbreak only began, like, what, say 5 months ago. If the virus mutates, will we have to make another annual vaccine, for just like we do for the flu vaccine? So at first, given the need that we need to reopen, we need to combine the vaccine with other epidemiological tools. So the least risky first, which is we're being told to wear a mask. New York State has mandated that people wear, the city has mandated that people wear a mask at all levels. Of course, they're the hottest spot in the country right now. Quarantining, such as the process that we're all undergoing right now. High risk people should be shielded or protected from overexposure or just exposure. And then there's a case to be made for case searching or tracing contacts. If they were to do tracing contacts or case searching in cities like New York City, it'd be almost impossible, because for every one person assigned to 1,000 population, there would be like 85,000 cases for them to follow up on, given the way that that is calculated. So we're not even going to go there today. But what we're currently faced with, and it's very reasonable, which is the authorities are telling us to be extra cautious. And they're saying that we simply do not know, or we cannot know enough of this very important information about this virus and what it does to our immunity just yet. But I think we would be okay to be a little bit optimistic about at least an effective vaccine that might be coming our way before too long, at the earliest by next year. And also before our individual herd and innate immunity kind of slips away in that scenario. So with this, I will leave you with a very important piece of information, which I have taken to heart in this scenario, and that is the price of health is absolute eternal vigilance at all times. You know what you're in for, and sometimes you don't. So it's better to be careful to prevent stuff from happening to you. And I will see you next time with more questions and queries. In the meantime, subscribe to my YouTube channel. Please like this video and post your comments, and I'll be happy to answer them. Thank you.